Hi, Marley. We can't hear you.
Got it. Just unmuted myself. How's everyone doing?
Good. We're about to start the meeting. Just give us 1 second.
Great. Sounds good.
First record to the cloud.
Be able to get in if I'm like this. Somebody about to.
Oh, that's true. We're gonna let them in, but we're gonna need you.
Let me go.
Let's do this. There we go. Okay, you're all set.
Okay, so we'll call the meeting to order. Jan unfortunately isn't feeling well. She was going to chair tonight, so I'll step in for tonight. I don't know that we need to do introductions, but maybe for Marley, and I don't know if Jacob is joining us or.
His sister is having a baby right now, so he was joining his family to welcome so
Oh,
he
good.
unfortunately sends his apologies, but he won't be able to make it tonight.
Well, that's an important thing to be there
It
for.
is.
That's right. So we can just start with introductions and then Marley, if you could take it from there and introduce yourself after and tell us a little bit about the subcommittee, that'd be great. So I'm Mary Hutchins.
I'm Marley Travis Winter.
Jessica Connor.
Frank Krupa.
Harmony Ayers Freelander.
Sally McConnell Shanae.
Larry Roberts.
Sheila McHenry.
Randy Brown.
So
Great.
everyone, I can't quite see. I just want to make sure we're not missing anyone before I start.
Yeah, that's everyone right now.
Great, awesome. I'm Marley Brooks. I am newly, just I guess in the last month or so, co-chairing the substance use subcommittee with Jake Parker Carver. I am currently working on my master's of social work at Binghamton University and finished my first internship with Tompkins County Whole Health, working with Rich Shaw in the dual recovery services for Tompkins County. And then this upcoming year, I'll be working with the Tompkins County ACT team and then working locally in some substance use mental health factor, hopefully after that. Jake and I have just been meeting and kind of getting our footing for both of us co-chairing substance use subcommittee. This is a new position for both of us. And we met with Harmony recently to go over the local services plan and just start to think of some topics and ideas that seem relevant to our community and that align with the local services plan. So we're starting to put together a few months out some topics and really just, I think in the next coming months, get some feedback from the current members of the substance use subcommittee and see what is of value to them in these meetings, and also do some recruitment to get our participation and members numbers up. We have a pretty small meeting usually, and I'd love to see more community members and representatives from different organizations and agencies. So we're kind of brainstorming on how to do some outreach in that way as well. But we're both really excited to be stepping into this role and just excited to be working with the other subcommittees as well, at any capacity that seems appropriate moving forward.
All right.
Great. Yeah, does anyone have any questions for Marley?
So thank you so much for stepping up into the role. We appreciate it. Look forward to working with you.
Yes, absolutely. Nice to meet everybody.
Thank you, Marley.
Great,
Take care.
thanks.
You guys don't mind if I saved your seat.
Hey, well, we are at a quorum,
We are.
everyone. Oh, great. Why don't we step back and look at the minutes? We need to approve minutes from April, May, and June. So we can certainly do that in one motion. So in a second. Okay, any discussion about them? I think everybody has their. Yeah. Thanks. No discussions, so all in favor of approving April, May, and June? Hey, looks like we've got that. Thank you. Frank, do you want to give a brief report or?
Sure, it'll be very brief. One, probably for anyone that might be watching or watching in the future, we are in a different location than usual. The building is undergoing a complete revamp of the HVAC system. So we've been struggling with temperature forever. They actually discovered some ducts that ended in iron beams instead of a vent in the office. So it's been a bit of a treasure hunt as they've gone through the building, but thankfully, Aurel Lamar, who's our facilities director, has done a great job putting a program together to get all of that taken care of, which hopefully will rectify a lot of our climate control problems. And they're starting on the 6th floor. So they're actually up there working right now. They work at nights to put in the new system as they go, and they're working their way down the building. Harmony, Jeremy, and others have put a plan together to help staff relocate because we can't be on the floor when they're working on it for a 2-week period because they're turning the HVAC off in order to put the new stuff in. So it would be very, very warm, as you can imagine. So kind of like the carpet plan for those that were around right before COVID. And we had to do that. We're not going to have a pandemic to make it easier. We'll work through it. The carpet went very smooth because there's nobody in the building. But that's good news for us as far as climate control. It's going to make for a better environment for both staff and clients in the building. Appreciate the county putting that investment into this building for us. Otherwise, on the opioid settlement fund front, the county side of it, the grant application process unfolded in June. And I think we got 16 applications. And so the members of the task force are reviewing those right now and scoring them. They'll have their first conversation about them tomorrow. And we're aiming for their meeting at the end of July to hopefully be making some recommendations to the legislature on how to allocate those funds. So it's been a long journey, but we're thankful to finally be looking at applications. There's some really good ones in there. So yeah, quite honestly, I don't think we could go wrong with any of the 16, and I wish we could fund them all. But I don't, we obviously can't. So I think there's going to be some difficult kind of decisions, but like I said, I don't think we can go wrong with any of them.
How many can you fund?
So the way that it was set up was 4 3-year fund, 4 3-year grants up to $165,000, and then 4 $10,000 grants, one-time funding. So most of them are for the 3-year 165.
Sure.
So and that's where it's going to be a bit.
Is that 1 or 3
It's 4.
or?
4 grants of up to $165,000 for 3 years.
Cool. I mean,
Yeah. Yeah.
that's significant investment.
Yeah, it was important to the task force that folks had multi-year
Yeah,
in case they wanted to bring staffing in as well, because it's hard to do that with one-time funding. So that's exciting stuff going on, and hopefully we'll be moving forward. And of course, Harmony is leading the process for the LGU side of things, and we're making sure that, you know, those things are complementary and not duplicative. Go forward. That's all I had.
I have a couple questions. One is, are any of the, I mean, you can talk in general, are any of them submitted proposals around public education and awareness kinds of activities?
Yeah, I think there's a couple of them that have a component of that, and
Good. And the other is just, can you give us an update on anything that's happening around housing, homelessness stuff?
Yeah, so I think everyone's aware that Tammy Baker was hired as the county's homeless coordinator. I'm not 100% sure what that's the correct title, but she's filling that role. I know she's been out in the community talking with a lot of different community groups. City of Ithaca has been moving some, I don't know if policy is the right word, but an approach through their committees. I don't think they've finalized anything yet, but that is mainly focused on camping and encampments and how to address those in the community. So I think there's quite a bit of conversation going on around it. And I do know that Tammy reached out a couple of days ago about talking with us, you know, from our perspective, meaning Harmony and I. So we'll be talking with her in the near future on that as well.
Okay, thanks. So we'll move on to talking about the local services plan. So Harmony.
One second.
So we're going to start with a little PowerPoint, and it's going to look familiar to those of you who are on the work group. You should have received in the email packet a document that's the plan itself, and also what's called the local service planning packet, which are more if you want to dive a little bit deeper, there's some information there. And wherever there was a document that you could get access to online, some of them were things that just sent to me from the state. But anything that's online, I gave you the link. So if you want to go in and read a little bit more in detail about those plans, you can do that. So this was a summary of, oops, I went too fast. A summary that I did for the work group, and then I think it's a nice summary for you as well, and then we can go in specifically and look at the plan. But the reason that we have a local services plan is because it's in mental hygiene law. It's in the 4116 is the law that impacts us as a county that says we'll have a local services plan. And then mental hygiene law 507 says that the state will have a plan as well. So OMH, OASIS, and OPWDD, all three of them have their own statewide plans. And the idea being that we inform the state and the state informs us. So we learn from what they identify as their priorities and goals, and we include that in our plan. But then they also take all the information of what they see as needs across the state into their own planning process. In 2022, there was a work group that was created. It included members from the state as well as directors of community services representing local government units, along with staff from the Conference of Local Mental Hygiene Directors who met on numerous occasions to come up with some ways to improve the process. One of the biggest concerns they identified was that a year-long plan didn't really make sense because we're talking about pretty big problems in our communities, gaps in services and so forth. They wanted to really have a plan that had a longer period of time. So they went from the 1-year planning process to a 4-year planning process. So the 2024-2028 will be the first 4-year plan. And there's an expectation that every year we'll just review our plan. So if you say, I don't know if that's an accurate date for something in here, because I did have to put a date down, and for the objectives, they wanted them to be around 2-year length of time. Some of them I pushed out for 3 years, but that was their recommendation, that you make all of the objectives about 2 years. I think we're going to look at some of them and say we did them, and we're going to look at some of them and say we need longer time. And that's okay because we get to review the plan every year. I think I'm going the wrong way. Yep, I went the wrong way. So what the state looks at really are the top areas of need that are identified across all of the LGUs. And then they also look and see which sections are they impacting. So they want to see what are the problems that most counties are having and what are the problems most counties are having in all three, OASIS, OMH, and OPWDD. So this is a list in order of the top 5 needs that they identified. And so you can see where it says for housing, there were out of 56 local government units that identified housing as a priority need in their community. 49 of them said, and it's across all 3, OASIS, OMH, and OPWDD. And so you can see all the way down there, workforce, it was 53 out of 54 that identified it. Crisis services, 38 out of 45, and so forth. So those were their top needs. And so that definitely informed our plan.
Going the wrong way. Right arrow.
Did I go back? Why do I keep doing that? I just need you to do it. Okay. So we also looked at our current plan, our 2023 plan, and we had workforce recruitment and retention. You'll notice themes that match what the state identified: housing, crisis services, and a new area called cross-system services. In 2023 was the first year that cross-system services was an area of need you could even identify. And it really is looking at the fact that so many times people fall through the gaps in services because a person might have OPWDD services, but they also have a mental health diagnosis or they have a substance use need, right? And they're crossing systems, and our systems aren't really well designed for that. So that was a new category. And then there was another category called non-clinical supports. And in that, we put a lot of different things. So this year, I kind of carved out a few of those areas, one being ACEs, or adverse childhood experiences, because it is a separate category in the list of categories they give you. So might as well put it in its real category. And also transition age youth needs. And if you have had a chance to look at the plan, you will see that children's needs, youth needs are pretty significant. Governor Hochul just had a listening tour across New York State, followed up with a large meeting in New York City just a couple of weeks ago, where she brought in youth providers and people from across the state to talk about the needs of youth, specifically around social media concerns, around the impact of COVID on youth. And so you'll see there's a lot of data in the plan around the needs section around youth. I got the right one this time. All right. I need like a little sticky note like here, right? So because we are supposed to care about what the state, think about what the state is looking at as priorities. I did include a couple of slides for the work group. One was about what are the main planning points. And when the state, they send out these little documents that say, these are our priorities for the year. They're also a way for the state to highlight all the ways they're spending money and how they're really meeting the community's needs. So it's a little bit of a PR document. So they tell you where they're putting all those dollars. So this is just a summary slide about housing, workforce, crisis services, and cross-system services. As you know, in our county under crisis services, our local hospital, Cuba Medical Center, did apply for both the intensive crisis stabilization center and the supportive, but they did not receive that RFP. It doesn't mean you can't do one without the RFP, but the RFP gave a lot of money for capital and it gave a lot of money for startup and operational costs that make it pretty difficult to do without that. So that was an unfortunate loss for us, I think, as a community. But they did fund those. And the nice thing about that was they were the first time there was an integrated license between OASIS and OMH. So that's their model program for that. One of the things cross-system services that they did was mobile medication units and Cuba Addiction Recovery Services did receive funding from that. And they, under workforce, they also did some paid internships, and Alcohol and Drug Council received some funding for that. And the idea behind that, we really not only want to strengthen our workforce, we want a more diverse workforce. And when you expect people to spend so much money on their education and then you can't have a paid internship, it limits who can really enter the field. So the idea behind the paid internships was to really look at how can we diversify the workforce? How can we get people interested in professions here? And our subcommittee had OASIS come and make a presentation about OASIS housing. And unfortunately, while there's a lot of money flowing through OASIS for funding for housing, none of the programs are actually in Tompkins County. I think we learned when they came and spoke to us, they're kind of like neighboring areas. So OMH's planning is around housing as well. They are expecting to build, use housing that's already in existence right now, and then to build housing out over the next 5 years. So it's not an immediate solution to the housing problem for people with mental illness and who have significant needs and maybe supports, but it is a step in the right direction. Crisis services, what they're intending in the new year ahead is 12 new CPAPs. Those are crisis stabilizations. Those are crisis psychiatric. I don't remember what CPAP stands for. Crisis psychiatric. I don't know what the E stands for. Emergency program. Crisis psychiatric emergency program.
Comprehensive.
Comprehensive. It's comprehensive. Okay.
Emergency program.
Comprehensive emergency program. Okay. So the nice thing about that is it's up to 72 hours a person can stay instead of the time frame, the shorter time frame. There's additional supports and services that can be added around them, so that they are planning to build 12 new ones. The RFP has not come out for that yet. They're building 42 additional ACT teams. So those are assertive community teams. I know what they stand for. And expanded Health Home Plus care management. I will tell you that what I've heard about the expansion with Health Home Plus services is that was a compromise deal, and that it may not be as, they're sort of touting it, but it actually was a compromise. And a lot of people are pretty unhappy with some of the changes they're making in that program. And the new Safe Option Support Teams, those are programs to help support people who are homeless, who also have severe and persistent mental illness and probably co-occurring substance use. Most of that is going into the city. There are a couple of piloted regional models. We're not in any of those regions where they're doing that, but it looks like it's a model that they're really starting to implement in very high urban environments first. And to see if that's going to help support people. And with the city, they've had a lot of crises with things happening on subways and stuff like that. So there's a lot of focus really on addressing that need there. Increase in number of hospital beds during COVID. Hospitals transitioned mental health beds to other kinds of beds and didn't change them back. So it's really a push to do that and also expand the number of beds. And then under children's services, there's enhanced home-based crisis intervention services and Children's Act. We just received Children's Act. Oh, yes, we're getting that program. So that's really good news. Children's Home of Wyoming Conference will be the provider of that service. They are very familiar with doing that program. They have done it previously. And RACR has a grant out for enhanced home-based crisis intervention services. It's been, it has not yet, there's a few more weeks, I believe, or maybe even a month before they're going to make announcements on that. So it hasn't been announced yet. Whether or not we got that, it'd be great if we could get that one as well. And they've enhanced children's service rates in schools.
I have a quick question.
Uh-huh.
So 150 new beds, are those actually gonna go to state psychiatric centers?
There's state psychiatric hospitals. That's where the beds are going.
And
And most of them are going to be down by the city.
of course,
Yeah. OPWDD also did their strategic plan. They finished that this year, 2023, 2027. And they created several goals in that plan. And they have like an easy to read document for their plan. I think everyone should have one of those because you actually can read it and you know what they're talking about. So they have 3 primary goal areas. They're basing their goals on their strategic planning goals came from a needs assessment that they did based on an analysis of all the data in their system. And they also did a number of listening sessions and tours across the state that I believe some of our subcommittee members went to. So they're looking at improving their IT, their staffing, and the collaboration of services in their first goal area, and then really wanting to make sure that the regulation doesn't get in the way of getting services for people and to provide more improved person-centered supports. And then there was listening sessions. I went to one of these, probably some of you went to those as well across the state. And in your plan, when you get in a chance to read it in a more detail, I talk about some of the things that they identified in that plan around problems with people going to hotels, and they were unsafe places or places where people were using a lot of substances, who had significant needs and who were unhoused. So that was one of the priority needs identified in our region. So they do break that plan down by region, which is nice. And they also did the youth mental health tour, which I talked a little bit about. It was nice. They had youth from Broome County there. And in the plan, I go in a lot more detail. So all of those numbers that are up there about youth, you can find in the plan as well. What's really alarming is not only are the rates of suicide increasing among youth and young adults, the homicide rates are also really increasing quite dramatically. So you can find all the numbers in there. A lot of the concerns are around social media and how can we help young people be more savvy around social media? How can we protect them from harm from that? And the crisis of racism as we have been watching carry out. Some of the interesting findings around mental health is that older youth tended to fare worse than younger youth during the COVID pandemic because they really needed the academic support. They really missed out on a lot of the opportunities socially and some of the big points that, kids look forward to in their life. So these kids that are going to college this next year, it's going to be really interesting. Probably they missed 2.5 years of regular high school education. So it'll be interesting to see what kind of challenges they face now that they're going to school. And then we also had a community survey that was done in 2022. Public Health does this, and you'll see that 17% of people rate their mental health as fair or poor. If an individual identifies as Black or African American, they have the lowest scores compared to whites at 2.9 compared to 3.5 on a 1.1 to 5 scale. The age of those who had the lowest scores were 25 to 34. So that young group that's probably trying to buy a house or buy a car or pay their college debt. And mental health improved dramatically by income. So those who were in the 15,000 a year bracket had a 2.7 score, while those in the 150,000 had a 3.8. Those who identified as transgender had the lowest mental health scores. So we looked at that information, and we also did our own survey. We had a total of 279 respondents. You can see how it broke down to 163 community members, 106 agency providers, and 10 board or subcommittee members. Some of the data that we got from the board or subcommittee members, I think that's how many people went in and did the survey, but not everyone did every single question. So sometimes you'll see like data that says 100% of the people said, well, not all of them maybe answered that. So when you get to the smaller board member group, the data is a little bit iffy, but the other groups are large enough. I think we have pretty good information. So you'll see that ACEs for community members was the 5th priority area at 79%, and it's the 4th for community and 4th for agencies. So that's why ACEs ended up. We looked at this information and said, okay, that ends up being its own separate thing because people really identified that. Housing and crisis services are in the plan. Cross-system services are in the plan. So many of these things are part of that, even though they may not be there as the top title, like some of the areas they cover in there. It's also broken down, and you have a copy of this as well. So you can kind of take some time and look at that. It's interesting to see people could say, what's the priority need by type, by OMH, OPWDD, or OASIS. So you can see the only time transportation really got on our chart was when it was under OPWDD from community members. Workforce under OPWDD was in that right hand, the third one over there on the right. Workforce was 48% by agency providers. It's the biggest issue, and transition age services for youth was what board members thought was the biggest priority for youth. So doing it by the different groups and by the different agency types, you get to see a little bit differently what people think is important.
Is there a way to break out who identified as direct consumers or direct, if anybody did, and also then family members, or is that not, did we not ask?
We asked if people had children, and about a third had children under the 18 or under.
Okay.
And so there is some demographic information in there as well. I think typical of surveys done in Tompkins County, the education level is pretty high, but I think that also reflects the community a little bit. So there are some specific questions in there. And then there are some interesting comments. We can give you the whole survey to look at because there are some, I think the comments part to me are more interesting than the numbers a lot of the times. So we can get that to you to take a look at and see if there's something in there. We also asked people about racial equity. So on the right-hand side of the screen, we asked community members and agency providers about where do they have the biggest concerns? And you'll see that for adults and for children. So the biggest concerns around racial equity, housing, employment, and criminal justice is what community members said. And agency providers said for adults, housing, access to mental hygiene services, and employment. So 2 of the 3 are the same. For children, community members were most concerned about the impact of school, access to mental hygiene services, and general access to healthcare. And agency providers were their primary concern was access to mental hygiene services And then access to quality mental hygiene services. So that's interesting. Now that's what agency providers are saying. We want to make sure it's good quality care as well. And then housing. So a little bit of a difference with children between community members and agency providers. On the left-hand side, you'll see we asked questions about where are you as an agency? So this information does have to be submitted to the state. They just give me some generic questions, but I thought it was good to have a survey data to say, like, how do I answer for the entire county? It's disturbing that 7% of agency people are saying we're not doing anything about it. Maybe they don't know what their agencies are doing. And another 23% are really implementing a plan already based on doing a lot of evaluation and research and idea formation on what they think will make a difference in improving health equity. So that's about 30%. And the other 70% are agencies that are somewhere in between. There's like 5 different categories they could choose from. And that survey came directly from that group of the Conference of Local Mental Hygiene Directors, state agencies, workers, and some of the directors of community services that worked on improving the local service plan process. So I used exactly what their tool said. I'm going to see, hopefully, I think they could get better information if they ask their questions a little bit differently. So maybe next time. 57% of people said that they felt like more training and toolkits would be helpful to them. They also said that having more local data could be helpful to them as well. And so those are 2 things I think we'll see the state trying to help support and the conference trying to help local government units support in the upcoming years, giving us more information that we can spread out to our agency providers. That's an overview of the plan. Then the next thing you have is the actual plan. And I think you all have a packet in front of you. And I listed all the tools right there. That are all the documents that we used. And then you'll see in the bottom of page 1, the 7 goal areas. So all of the goal areas remained the same as our current year's plan. I just pulled out under the non-clinical supports, the adverse childhood experiences and the transition age services is separate because we had peers in there. We had health equity in there. We had a lot of stuff going on under that one category, and it just seemed like we needed to pull them out into separate categories. There are the workforce goals, really about helping recruitment and retention, all of the objectives. I'll just try and do a brief summary. Does that work for people? You don't really want me to read all this to you, right? It'll be horrible and painful. So basically the idea being, and we saw this right when we reviewed agencies that got contracted funds, that a number of them were not meeting their outcome measures as they had expected. And a lot of the reason for that was workforce shortage. So this is really about finding out how bad is it? How bad is the workforce shortage? Can we get more information from agencies? And can we get more concrete information about how does that shortage really impact access to care so that we can do a better job advocating on the need for more funding, more support. A lot of the ideas, it's going to take time, right? If you start, you're now doing scholarships to try and get people into the field, but that takes time. We're going to have people go through school. What are we going to do in the meantime? What are some creative solutions that people might have out there? And how do we work on improved diversity? So I think they're going in the right direction by doing some of these paid internships, by paying for some of the education. It's not going to be a quick fix. What are some other strategies we can do as a community? So that's the big focus on workforce. And you'll see there's a responsible group. So some of them, I know these are things, this is so big, it's going to come to the whole community services board. Some of these objectives or activities might just go to a particular subcommittee. Some of it might be some things that I'm specifically working on with people. So try to expand that category out a little bit this year. So under housing, I think we all know that the affordability of housing is a struggle for many people, and access to mental health service housing or substance use housing is a challenge. They did ask this year in submitting the local services plan, they won't let you submit it until you tell the state all of the unlicensed programs that provide substance use related housing. And I think the reason they might be gathering that information this year is because they're looking at some of those opioid dollars and looking at some non-traditional ways to spend those dollars. So keep your fingers crossed. But I tried to think of every agency I could think of to put on that list. And I hope they don't end up like torturing them, telling them they have to fill out a lot of pieces of paper and instead give them money. So we'll see what happens with that. But they are, Oasis in particular is looking at that on non-traditional kinds of programs because they do have that other funding.
Approximately how many are there?
You got that list. There was about 5 or 6, right?
There's about,
Chartwell, Magnolia.
there was a few more,
There was something Catholic Charities did.
yeah.
Chartwell and Magnolia are not licensed? Okay.
Right now.
And hopefully soon there's going to be the sober housing program
Right.
through Roy Murdoch's work. So there's a pretty good list of programs, but they're small. They don't house a lot of people and the need is huge. So there's definitely more of a need there. There is some funding out right now. It was just released last week through OMH for supportive apartment housing. And there's a percentage and there's some that's designated for Tompkins County if we have a provider who decides to put in a request for to submit a proposal for that. So we'll see what happens with that. So they are looking at housing right now. So there's our goals really are about understanding, like one of the things that we know, we hear people say, well, many of the people who are unhoused have serious mental health problems or substance use problems. Well, how do we know that? How do you quantify that? How do we get a better handle on understanding what that is? And then how can we gather more information on what housing solutions are available? One of the programs that was identified in that listening tour that OMH did for the Southern Tier was a program in Chemung County. And it almost sounded more like foster care to me, where people would learn how to have someone come live in their home. They would get special training and somebody would come out of a hospital and come and live with them as part of the family. And I thought that was an interesting model. And I heard we had something like that years ago and it went away.
Years and years. I mean, it's a fairly traditional way of thinking about how to help people.
Yeah, yeah. And some of these things may be not so expensive, right? It's about getting support for people and making sure you're putting together a nice supportive plan for the family and you've identified somebody that's a good fit for. But then you're building in friendships, supports, connections right along with the housing, because housing alone is not sufficient to meet people's needs. So there are some interesting ideas out there. We want to learn more about those and find out about some housing reductions, especially in OPWDD. We know that we lost some housing during the COVID period of time. And is that going to get replaced? What's going to happen with that? And make sure that we're on top of that. And then really advocating for whatever kind of housing solutions. And we've done a lot of that work already in some of our subcommittees and even as a board. So just continuing that process. Crisis services, it's really looking at having a comprehensive system of crisis response. You have to have, I think of crisis services as sort of like a medical thing, like right, a doctor would say you want the right dosage at the right time, right? And people need different kinds of crisis responses. And I think it's confusing the community because it's a pretty complex issue. You need the right response at the right time. And some people need an ambulance. Some people may even need law enforcement. And some people need a kind, supportive peer, right? And you need the gamut and you need a place to go. So the OMH model really is someone to call. We have 988. Someone to come and is figuring out how to make a more robust mobile crisis response and some place to go. And that would be a crisis stabilization center or something like that. So we want to know what the best practices are. There are some piloted programs out there right now, some of those, that SOS model that they're going to be using in subs in New York City. Can we learn from that? What can we learn from that crisis program? There's a piloted integrated model between OMH and OPWDD, because one of the problems has been that OPWDD people tend to get left out in crisis response. So what are they going to do in that model? And can we learn from that when they have their findings? So we really want to look at that. How can we expand what we have already? How can we improve communication between law enforcement and people who experience a mental health crisis? The CIT training, that's the part that the officers enjoy the best, is when people come in from the community and talk about what their experiences are like. It really creates empathy. It creates deeper understanding of what it's like to be having a mental health crisis and needing a law enforcement person to respond. And then support effort
Having one respond.
or having
You
one
didn't
respond.
think it needed to happen.
You might not have, yes, yes. And here everyone around you is telling you you need this, but you may not think you need this at all. Yeah. And supporting efforts to establish something like a crisis stabilization center, and also support the suicide prevention efforts. Because we have a pretty robust suicide prevention coalition that's supporting the zero suicide model. How do we keep doing that? And then we go to, okay, missed. The next one is. I need to flip my page. That's my problem. Cross-system services, that's the next goal area. And that we talked about how like people, there's a problem right now if a person is OPWDD, they may be having OMH services while they're waiting to get an OPWDD services. And then when they get an OPWDD, they lose their OMH services. And so there's work out there to try and fix that problem, because people can need services that cross different systems, and they shouldn't lose a service where maybe they're really attached to that provider. They've really stabilized there. Now suddenly you finally get in the right system with OPWDD. That could take a long time, and you lose all of the other supports you already have. So those are some of the things we really want to look at. Removing barriers to access services across systems. That's objective 2. That's what that's about. And make sure people are aware of available services and systems as well. And sometimes that's not just the general public, it's a confusing system. So that's for providers too. And improving coordination across that system. And data integrity, collecting information on opioid overdose. So this was something the work group felt that we really needed to keep in the plan. I was trying to find a good category for it. And the opioid overdose epidemic crosses everyone's system. So it seemed like the best place to put that in there, that we really want to keep tabs on what are our needs in our community around that, and not just deaths, getting some of that upstream information. There are definitely groups that are working on that. So just keeping our finger on that work as well. Clinical supports is really focusing on, there were members, I believe it was an OPWDD subcommittee, very concerned. And I don't think this is just for people in OPWDD, about access to dental and optical care and healthcare in general, if you're a Medicaid recipient. And making, like, let's look at, if we believe the social determinants of health matter and people need access also to they need good housing, they need a place where they belong, they need employment opportunities, but they also need legitimately good healthcare, right? And there can be a lack of that. So focusing on that. And improving access to quality mental hygiene services for minoritized populations. You could see how that goal flowed right out of that survey data from people as a concern. Improving health equity in the mental hygiene system. It's a little bit different, identifying strategies to improve health equity across Tompkins County mental hygiene service providers. That's more around that information where agency providers were saying, I could use a toolkit, I could use a training, I could use, how can we help support that work that agencies are doing? And a greater awareness and utilization of peer support services that can strengthen engagement and recovery across the system. Adverse childhood experiences, we have just one objective in there. It was really interesting to see. I can say some of our survey respondents were very confused about problem gambling. So our takeaway from it was either the question was written poorly or people really don't understand problem gambling in our community. We need to do more on that. So we may need to do more on awareness on problem gambling. But ACEs, people really understood not only that it impacts children, but it impacts adults and that we need to address it comprehensively that way. So there's one goal objective for that.
What Harmony means is a lot of people identified problem gambling as a major problem. And
The numbers were really off the chart. Thank you.
how is that possible? So we think there was a problem with the way the
Okay.
was asked.
Is the question said, is it an adult only problem? So we think they were answering an adult only problem, not that it was a huge problem.
Right. So we just have to, I mean, I'm sure there are people for whom that kind of behavioral addiction is a huge problem, but I don't think it was reflected accurately.
Not to the level. Yeah, the numbers were just not off the chart. Like it was the biggest problem in our community was problem gambling. And like, I don't think that's accurate. But with all the legalization of gambling, COVID like happening at the same time, there is probably a bigger problem. So we need to figure out what we're going to do with that. We think it's something we need to put some energy in trying to understand that. But I think it was we thought it was a misread of the question. I mean, and it's actually adolescents and college students you probably want to be most concerned around for prevention of problem gambling. So there was a lack of awareness on the public's part on that part. Transition age youth, that's where I have a lot of stuff, Randy. You can find all this stuff right there. If you want to make a case for why we need to spend more money on kids, it's right here. And so, but some of those things I talked with you about already about the homicide rate that's going up with youth. I also included some information when we talked about people who are unhoused. So there's a really, and you can go to the link in here, there's a really good report that's written by a young person from our community on being homeless and being a teenager. And one of their biggest requests is access to more mental health services. So that information is in there because it does directly relate to our department in that way. And then you will see that they're really under this area that all the subcommittees have different areas they're working on. Developmental disabilities has been doing a ton of work and will continue to work on transition age youth, because if youth don't get connected to the adult system of care in high school, then it's very hard to get them the services they need. And I think the term is graduate to the couch, and we're trying to make sure that that doesn't happen. So that's been a huge emphasis for the subcommittee, and they're going to continue to do that work. Mental health is doing a lot, is very supportive of the Collaborative Solutions Network, really doing a lot of work around trying to address the needs of children across both the prevention and the higher intensity. So that grant that we're waiting to hear about came from we were able to hire a grant writer with some dollars from our Collaborative Solutions Network. And that was used to write this grant and hopefully get another high level service in our community. So we'll see how that works out. And working on improving communication so people in the community know how to get access to all the services that we have and that it's a friendly system. And substance use, talked to Marley and Jake and I talked a bit about just the rate of substance use among adolescents. And you'll see in this report here, the rate of drug use has increased 61% nationally for 8th graders between 2016 and 2020. So what can we do to really start to ensure that we have robust prevention programs and early intervention supports for youth? Because we really are seeing this impact from COVID on young people, and it happened before that. So it's the social media mix of things. It's the isolation from COVID and so forth. There's just a lot going on for young people, and you can see it in some of these statistics that are pretty troubling. So the objectives there fall under each of those specific subcommittees.
I'm just curious, the drug use, does that include vaping or not in that statistic?
It probably does, because a couple of years ago, I don't know now what it's like, but vaping was horrible, and kids were using everything they could in vapes, and vapes are so easy to hide. Not like it used to be, you smoked in the bathroom, right? And everyone could smell it. There were parents who thought it was a health product for their kids when vaping first came out, right? So create a whole generation of addiction by not passing laws to limit the amount of substances. You know, vaping was supposed to be the thing to get you to quit smoking. But the nicotine, even the nicotine amount that they allowed in vaping was just off the chart. And then they put everything else under the sun, and you could buy it anywhere.
And any
So-
flavor.
Well, and that's another thing, just the whole range of, flavors and colors and packaging of all kinds of both drugs and other kinds of things that affect the people's moods that don't qualify as drugs, but people are still using.
With pretty significant health effects.
Yes.
So that is the plan. Any questions about it? Any thoughts on it? Anything we should add? One area we don't touch on here that I think we want to keep our eye on this year is the aging of people with serious mental illness who are in some of our housing programs. And I'm hearing this from other counties as well, and I'm not seeing a big push on that, but it may be something we want to explore this, upcoming year or so. It's like, and it's very, very hard to get someone in a nursing home, nursing home care. My understanding on that, and it's limited, but there's something about, there's rules for nursing homes around psychotropic medications. They want people on the minimum amount because they don't want them to be misused as a means of just sort of, if I give this person a lot of medications, then I don't have to deal with them. I don't have to, they can be abused, right?
Also increasingly unsafe the older you get.
Okay, so it sounds like there are people that they just can't get, they'll make like 30, 50 referrals and they can't get a person into a nursing home. And yet it's really not safe for them to be in the community level anymore. But there's no program, there's no place that will take them that can meet their mental health needs as well. So we've got a lot of people who are aging. And I'm hearing this across other counties too. They're just seeing a big trend in that area.
Maybe we can make some connections with the Office for the Aging about trying to raise awareness of that as a problem. I mean, it's really, I'm not surprised that New York and probably no other states, but New York particularly didn't pay attention to this when they started to really focus on the community, because,
You have to be able to transition people to other systems at some point, and if that other system doesn't have the capacity or they're afraid they don't,
or the willingness.
or the willingness, yeah. Yeah, that's an up and coming issue.
Jessica, you had a.
Yeah, a question, a little bit logistically, just wondering how this plan interacts with any regional plans. I feel like there are a lot of services in New York State that are thought of on a more regional basis. And also just wondering if they're like in terms of advocating for our county within a region, like would that fall under being placed in a plan like this? Or is this more of a like county down kind of plan and less of a?
It's a communication tool actually to the state. So they do like all that information about how they took a summary. So it's a communication to the state, and there are regional programs. And certainly, so when they start looking at those themes, when they're thinking about programs they may want to build or add to, then they're going to look for those kinds of themes. But it's an advocacy tool for the local level, the regional level, and the state level.
I just have a question, maybe directed to you, Randy. Does the legislature get this plan? Is it, or do you share that information?
Same question.
Oh, okay.
We can get it to them.
So there are a lot of things in here.
To the Health and Human Services.
Sure, we can line that up.
Yeah.
It used to be posted online, but Oasis is in the process of updating their system where they put them. So you used to be able to Google them and you could find them on their site. But this is the second year where they literally give you like 4 forms and say, fill these out and submit them, and they go somewhere you never see again. It's not like you go into a website and actually enter it and then you can go online and pull it. So we may want to just post it too. Because it doesn't seem like there's an ability to go and see all, because I would go and read other people's plans, see what are you working on?
There's obviously a lot of need. I mean,
Yeah,
Talking about
right,
stuff.
right.
I've particularly been focused on youth services and whatnot. And I'm not sure it's a real appetite for the county to spend a lot of money on that. I'll advocate for that, but we'll see what that
Right.
goes. I think it's important.
Well, I think certainly some of the statistics that you cite, like drug use,
It's, yeah.
ACEs, I think it's really relevant information.
Yeah, in my personal conversations with people have been just what, you just reported. It's, you're not saying it. You mentioned, everybody's struggling for health industry qualified applicants. What discussion is there for hiring people? I mean, it's tough to find people, and what solutions have you heard?
Well, I think it's going to take, I think we're just going to bump along for a while because they're really, I think you just have to you have to make your workplace a place people want to work. It's competitive. So whatever you can do to make it an attractive work site. The salaries in this profession have been so low for so long. People haven't entered the field because the cost of education is so high. Like people can do the math and say, I'm never going to own a house if I do this for a living, right? And so that's why I think we have such a problem now that we don't have people entering it. I don't know if the rates of pay are where they're eventually going to go because there's such a shortage. But I think OPWDD of all the 3 O's has the best plan. They put a lot of detail in it. They're working with BOCES. They're working at the high school level. They're looking at community colleges are doing plans. They're putting certifications together so a person doesn't necessarily have to get a 2-year degree. They can get certified in certain things. And some of our agencies in the community are paying extra if people get some of that training. So it's like getting people to start in the profession and then get that career ladder going for them and creating opportunities for some of that education to be paid for, because it's really cost prohibitive to enter the profession and it takes a long time. I think, I would say for us as a county employer, the civil service exam tends to be a bit of a challenge for us because you're taking people who already had to take an exam to get licensed, right? And that's not good enough. Now you need another one too. And I think in our profession, people have a lot of test anxiety. I don't know if that's true of most professions, but it just seems like, there are people you kind of drive away with that and they've already had to take exams. So whatever you can do to make it a more attractive profession and be inviting to people.
I also think that, I don't know if this will remain true, but I think at the moment, there are a couple different options for people, like telehealth and teletherapy, where you don't have to be connected to an agency that has oversight and rules and expectations. You sign up with a company and you do therapy with people from your home, and you don't, you might not have a supervisor who comes and says, your paperwork isn't filled out correctly. And here are the expectations. So I think for a lot of people who are interested, the option of being able to do essentially private practice in a new way is really seductive.
Mhm. Yeah, there's a lot more competition and a lot fewer people who are
Right.
qualified to do the work.
There's also some advocacy efforts at the state level to get greater legitimacy assigned to various master's level mental health professionals who New York insurances are largely ignoring their capabilities. So people with licensed marriage and family therapy degrees licensed mental health counseling degrees. If you have the LMSW, so the licensed Masters of Social Work, but you haven't done the additional 3 years to get the C or the additional 6 years to get the R, but then they got rid of it. So efforts to encourage insurance companies to see the legitimacy of these mental health providers who are often are only able to work in very select places. That's going on at the statewide level.
I also think the complexity of the work is, I mean, part of what I'm thinking in terms of the planning process here is whether or not all major OPWDD or OASIS actually figures out how to work across systems, at the state level. Local providers are going to have to figure it out because the complexity of the needs that the system is being, and also not just the needs, but the risks that the systems are being asked to take on.
I'm wondering if we have enough information at this point to take a vote and approve. Okay, does someone want to make a motion?
Motion to that.
Okay. And Travis, all in favor of approving the plan?
Thank you for all your hard work.
Yeah, it's very, it's very readable too.
Yes.
Yes.
Good at that. I agree.
Yeah. Yeah, and it really seems to reflect what I think we're all experiencing. So that's good.
Two pieces of feedback. One, I underlined the 61% nationally increase. That's crazy. The rate of drugs has increased. That's, you see it, you hear it, but you see it in black and white. And the perhaps newer approach of addressing the elderly. I've been around this community for 40 years, and there was a time when we worked together at the hospital. Trying to get somebody into a nursing home was a large effort. You got the Medicaid and you got the private, and that antiquated system is still going on today. There's just not enough nursing home beds, and yes, I think that needs to be addressed. So happy that that's coming out of the conversations as well.
I'm just curious, Travis, do you see at the college that you're seeing the increase in drug use? You've worked at GC3 and.
Depends on which area I'm in, but yeah. I assume that includes marijuana, and I don't know how to filter out legalization and increase.
Well, this was
Assume they-
graders, so.
But that's what happens. My understanding from the research is as legalization happens, age of onset goes down. It's very common. That's what happened in Colorado.
Right.
So 8th grade would be about the place where that would, I think, start to happen more. Problem is the chemical compound of marijuana now is THC is much higher. So the impact on the developing brain is greater, and it's often laced with other things by medicine, right? So I don't hear as much talk currently, at least amongst that population about crystal meth like I used to. Meth doesn't seem as popular, but cocaine and a lot of psychedelics are. A lot of discussion of mushrooms, that kind of stuff, experimentation as it becomes more vogue around discussion of mental health treatment. People decide they're going to do that on their own.
Right.
So I do see folks, and we don't have anybody locally who does licensed ketamine or anything like that. You have to go outside, right?
We have one.
Do we? We have somebody local?
Licensed ketamine?
Yeah.
Yes, which second?
Well,
Which second is it? There's a local psych.
there's someone who's overseeing some of that. So, folks were for a while doing that on their own, but
Short, sorry for that. I'm looking at it. And then the LSD ingredient in therapy, that's is a segment of the population. I don't know if anybody's doing that in Ithaca either.
Oh, yeah.
there's a lot of interest in it.
There's a lot.
And so I imagine it's going on.
Yeah, no, there's a lot, and you may know more about this from your work than mine, but I had heard stories of a lot of folks who are trying marijuana for the first time or, thereabouts the first time. And because they had no experience, there was a lot increase in psychotic breaks. That's what I was hearing. So people were presenting with, marijuana induced psychotic breaks,
Sounds like a topic for future conversation either here or in a subcommittee.
Yeah.
Definitely a concern.
Yeah,
And
Yeah.
I would say to your point, if they don't pay for the at-risk youth now, we're gonna pay for it later.
exactly.
So, one way or another, we're not escaping those costs.
Yeah, it's more expensive later.
Yes.
Amen.
Yeah, no, Frank and
Yeah.
Harmony would agree.
Amen.
Mary left and she
I'm
asked
not
me.
giving up.
Mary left, she asked me to take over. Looks like we've completed the agenda.
If I could just make two quick announcements, well, actually three. One, I want to thank Harmony and Karan for putting that together.
Yes.
Huge amount of work. And the state is now 8 for 8 in my 8 years, and it's been different every year that I've had to do it. So hopefully the 4-year thing will slow that down a little bit. Two quick announcements that I missed. One, the pharmacy is very close to opening, likely in August. So if you look over there on your way out, you'll see their signage is up for Genoa. They hired Nicole Pagano, who was the pharmacist over at Green Street Pharmacy.
Oh, great.
Right next door, if you remember.
Oh, great.
She's awesome. So we're super excited. She's super excited to be here. She knows our clients, and she wants to do that work. So the Board of Pharmacy was supposed to come today to do their site visit. I don't know if that occurred, but I know she was expecting them. And we're going to have them be presenting to leadership and staff over the next few weeks. And we're looking end of August, end of August.
Yeah, they're thinking August 7th, the week of August 7th, they're open, but they want to do open house, I think probably a month or two after that, like we work out the bugs, do a soft opening, and then there'll be a ribbon cutting or something like that to invite you to.
Yeah, so that's super exciting.
Awesome.
As it moves along, it would be nice at some point, like maybe 6 months from now, to have a presentation
Yeah.
about how it's going and what the bugs have been.
And that sounds about right for them with their data. You got to give us 6 months before we can tell you anything.
Yeah.
And initially, it's going to be for folks who use the mental health services, but it's going to be open to the whole public.
So it's a specialty pharmacy, and their focus is on people with mental health issues, and they're going to be supporting the folks here in the clinic. They can serve the public as we understand it, but they're not necessarily supposed to be competing with CVS and Walgreens and the other type pharmacies I might be getting the language wrong because they might not actually be a specialty pharmacy.
Yeah.
There's some
technical.
there's a particular language in their licensure that allows them to do what they do for our population. They, like our staff could also get their pharmacy needs met. But it's really focused on folks that have mental health issues, concerns, diagnosis is the word I'm looking for. So not just in our building, but some our community partners as well that might have, and it's a place for them to come where the staff in the pharmacy are more well-trained around those issues and those medications and can help answer questions and support people that are taking those types of medications.
Right now, clinic staff does injectable medications for some clients.
Yes.
Will that transfer to the pharmacy or will we continue to do what we do?
I think we're still
I think
doing
we're still
that.
doing
Yeah, I don't
injectables.
think-
But if we had an issue, like the nice thing about having a pharmacy, if we had an issue, like we couldn't get a supply or something
Right.
like that, we'd have them to help us with that.
Good.
So that's good news. The other bit of news is we are now actively recruiting for a new medical director. Dr. Lippert is still with us, but as you may know, he actually retired during COVID and came back to help continue supporting us. But as now that's 2 or 3 years ago, he is looking to kind of, transition to that full retirement. The legislature was kind enough to allow us to move the salary up to what we believe is a competitive rate, at least with the state positions for psychiatrists doing forensics type work and others. And so if you know of anyone
What is the salary?
at $299 annually for 40 hours a week. We're gonna do an initial kind of beat the bushes locally to see if there's anyone that might be interested with that new salary. If we're unsuccessful there, then we're committed to hiring a recruitment agency to help us go out and find
Be
someone.
nice to make sure that we're looking at their ability to work with youth and children.
Yes, absolutely. Do we know somebody like that?
Well, I wasn't.
And I don't. No, we agree.
Having other talented bodies that help do that.
Yeah, we absolutely agree. We've also been talking about that from a nurse practitioner perspective as well. Trying to help fill the void. So
I have one other question related to hiring and stuff, which is about the alcohol and drug council. So Angela left and Helen has left. I'm wondering mostly about the recruitment of the executive or the director. Do you know what's happening?
I know they are undertaking a national search, as most places do. I don't know the status of that search.
Okay.
Family and Children's Services is also struggling.
Yep, Family and
Hiring,
Children's is also
hiring
missing a
directors.
clinical director. They're recruiting for
An overall director or a clinical?
clinical director.
Clinical director.
So Karen left or?
She left a while ago.
Oh,
So Alicia Canali is the executive director. Marissa Matadori was their clinical director and she moved out of state with her family and recruiting since she left.
And now their two interim directors are down to one interim director.
so
They have a long way.
So the council lost the CEO and the clinical director?
Correct.
Wow.
The
Is that
council.
impacting access?
Their wait times are way far out.
Like when you say far, how far?
There was
6 to
something,
12 months for a job.
yeah,
Months, yes.
yeah.
With-
There's even a notice on the website, like, that.
And when people are calling them, they're highly recommending they seek services elsewhere
6 to 12 month waiting list?
for a child to receive therapy.
it would seem to me that it would be good to have some more concrete information about.
That's an all-time high.
Well, we know they're recruiting. They're
Yeah, yeah.
actively recruiting.
Like,
They're also therapists are actively leaving.
Is the detox center still not open or?
They can't staff it.
It's the staffing is the problem, getting the nurses. They were closer.
They're partially open. But I don't think they can do that. They're doing the walk-in, but they can't do the detox yet because the detox, you need more nursing.
Right.
So they are partially open.
So this is like a national, this is,
Oh, yeah.
it's not an Ithaca
No,
No.
issue. This is a national issue.
Yeah.
yeah, I mean, part of the problem is
$25 an hour at the county level. Right? Like the sign outside of Target says $17.50, come right this way. I just don't think that, for years, the agencies, the salaries of people working there have been underfunded. And it's,
Housing,
chickens are
child.
coming to roost.
My niece is a nurse at TC3 now and
Do
she
remote,
gets recruited nonstop.
Oh, yeah.
And the numbers just keep going up because they just can't find people.
Yeah,
It's a challenging time.
it is.
And she does.
All right. Any other questions, comments before we adjourn? Okay. I need a motion to adjourn, right? Larry and
Second.
second.